Hello and welcome and a wonderful happy Independence Day to all our viewers. Our doctors, nurses and other hospital staff have been carrying the heavy burden of the pandemic while working within the limitations of an inadequate public healthcare system. With 0.55 hospital beds per 1,000 population and under 15% of ICUs across the country having dedicated critical care doctors, this campaign is to help bridge some of those gaps for better patient outcomes and to make sure that our healthcare workers are safe themselves. To support our healthcare workers and protect them from falling ill themselves in the line of duty, there are three areas which have been identified in this very special telethon in India's battle against coronavirus. Door-to-door community screening in hotspots, provide certified personal protective equipment, PPE kits and masks, and scale plasma donation and facilitate home quarantine and solutions. Nidhi Kulpati and Dr. Pranoy Roy with us on this program.
आप सभी को 74वें स्वाधीनता दिवस की शुभकामनाएं। तो आज हमारा देश चुनौतीपूर्ण कोरोना महामारी से जूझ रहा है और इससे मुकाबला करने में डटे हैं हमारे डॉक्टर्स, नर्सेस, स्वास्थ्य कर्मी। तो आज इन कोरोना वॉरियर्स की सहायता और हाथ मजबूत करने के लिए ये खास कार्यक्रम कर रहे हैं। हमारा लक्ष्य है कि संक्रमण की रोकथाम, उपचार और बचाव के लिए योगदान इकट्ठा किया जा सके। गिव इंडिया 20 साल पुरानी संस्था है जो देश में पहली अकेली ऑनलाइन डोनेशन प्लेटफॉर्म बना जिसने योगदान को एक व्यावसायिक प्लेटफॉर्म दिया। गिव इंडिया से करीब 1500 एनजीओज जुड़े हुए हैं जिससे समाज के अनेकों क्षेत्रों और संगठनों की सहायता होती रही है। गिव इंडिया ने अब तक कोविड रिस्पॉन्स फंड में 200 करोड़ इकट्ठा किए हैं जिससे करीब 40 लाख लोगों की मदद की गई है।
In fact, yes, Nidhi and Vishnu, yes, I think we all feel that today's telethon is focusing on actually one of the most important aspects of this pandemic. You know, we all admire our army and our soldiers fighting at the border for all of us. In the same way, we admire the doctors and nurses and medical staff who are at this front line, risking their lives actually just to save ours. And we know over 100 doctors and nurses have already died as a result of catching coronavirus from their patients. And many, many more medical staff stare death in the face every single day for us. Just think of it for a moment. What the family feels like every day, every morning, every afternoon that a doctor or a nurse or a medical staff leaves home to treat and look after COVID patients. We salute these frontline heroes and dedicate this entire program to them, and it gives us great honor to do that. God bless each one of them. Just before we start, there's one bit of encouraging news that we must share right up front. The coronavirus pandemic in India is improving a little bit, the situation. Now, every nation uses a measure called R, the reproduction rate. We don't use it much in India, but it's used all around the world to see how fast or how slowly the virus is spreading and how deadly that that virus is, and is that really affecting us. Now for R, we got the help of Professor Sreena, the wonderful professor who does a much more complicated, but he gave than this simple calculation, but this is the formula he gave us. All the errors are still ours, but this is what it looks like. Here is the encouraging news. As you can see, the overall effective R in India is coming down a little bit from 1.2 to just over 1.05. Now that is great. It's hugely important. Now, having said that, we of course have a long way to go. We must carry on and go below the target for India and for all countries of R being less than 1. You can see that red line. We need to go below that and make sure that it carries on. In England, for example, which started with an R of over 2.5, now has an R of about 0.8.
That R factor is absolutely critical in giving us an idea of where we stand in this country. That's the same question that millions of people keep asking. How many more months? When will we start getting better as a nation? Well, joining us now, Atul Satija, founder 2.0 and CEO of GiveIndia. It's absolutely wonderful, Atul, to have you on this program. Tell us first a little bit about the organization's history, the purpose with which it was founded 20 years ago. Atul.
Yeah. So firstly, thank you so much for having me. It's great to be a partner of NDTV in this telethon. GiveIndia actually started way back in 2000 with a very simple but a very important purpose, which was to serve and support our poor. We realized that there were a lot of people on one side who were actually having the resources and the intent to help and serve, but a far more number of people on the other hand who are actually needy, who need help. And we thought, why not create an exchange? Why not create a platform that encourages people, enables people to actually give back to the ones in need? So that's how we launched the GiveIndia platform way back in 2000. We also felt that just creating the platform will not make people givers. The most important thing was to make sure that donors have the confidence that their money is actually going and changing the life of someone. So the bedrock of the entire thing we were doing was, how do you do the due diligence, the verification, so that every non-profit, every program on the platform is actually verified to give the donors that confidence. So that's what we've been doing for the last 20 years. Very proud of the fact that we are India's first and the most trusted giving platform.
जी अतुल, जिस तरह से आपने बताया कि 20 साल पुराना संगठन है और विश्वास आप लोगों ने कैसे जीता है, मैं आपसे ये समझना चाहूंगी कि इस 20 साल के दौरान किस तरह से आपने अपनी संस्था को इवॉल्व किया, रिपर्पस किया कि, और खास तौर से अब कोरोना के दौर में किस तरह से ये उपयोगी हो रहा है?
Yeah. See, on one hand, if you look at it as an organization, we have not evolved at all. कुछ भी नहीं बदला है. We started the organization so that हम अपने fellow Indians के काम आ सकें. We should be able to help people. In that aspect, we have not changed at all. We want to do this for the rest of our life. But if you look at the journey of the organization, the evolution of the organization, we started by creating a very simple way for people to come and give small amounts of money from their salary. लोग अपनी सैलरी से 50 रुपया, 100 रुपया, 75 रुपया, 20 रुपया एनजीओ को डोनेट करते थे हमारे प्लेटफॉर्म से. एक सिंपल सा वेबसाइट था जिसपे लोग आके डोनेट करते थे. Over time, what we did is we brought, for example, we partnered with ProCam to bring the culture of marathons in the country, integrated with charity. We brought India's first crowdfunding platform in 2006 called iGive. As middle class was growing in India, जैसे लोगों के पास पैसा आ रहा था, we started consulting HNIs and UHNIs, and we brought giving pledges to India to encourage people to give back. So इस सारी गिविंग की जर्नी जो इंडिया ने देखी है पिछले 20 साल के अंदर, we had a small role to play in almost all of that. Over the last 4 months, since we started working on COVID, we have seen amazing generosity coming from people from all walks of life, not just rich, but very, very normal people, COVID warriors coming forward and donating. We have raised money from more than 3.5 lakh people just in the last 4 months.
That's fascinating.
But अगर आप हमारी पूरी जर्नी देखें, so, it's been like 15 lakh people and like 700 plus crores is what we have donated on the platform so far.
Yeah. Now, Mr. Satija, you're connected with thousands of donors on the one hand and hundreds of NGOs as well. How difficult is it, or how important is it to earn their support and eventually trust? How do you go about that business?
See, ultimately, everything we do is built on trust. Because the donor is trusting us with their money to make sure that it is actually going and changing someone's life. So what we do is we actually spend a lot of time verifying the legal aspects of the NGO, compliance aspects of their work, financial aspects. We send our team in person to the ground. I mean, our teams have to go travel in trains, travel in buses and meet NGOs wherever they are, even surprise visits to the beneficiaries where they are claiming they have given the service or the product or support. So that when we go to a donor, we are very confident that every single rupee is doing what it is supposed to, which is changing lives. So that is one part, right? Trust is one part. We also have to make sure that giving is very convenient. So we work with close to about 150 partners, where we actually make it very easy for people to come and give, whether they are on Facebook, whether they are on PhonePe, whether they are on platforms like Cred. We want to make sure that people give wherever they are. And we also want to provide the choice of giving, so people give to the causes that are closest to their heart. So that's sort of the work we have to do on this side.
Sure.
बिल्कुल अतुल, बहुत बहुत धन्यवाद हमारे साथ जुड़ने के लिए। उम्मीद करते हैं कि आप और भी कामयाबी हासिल करें, और जिस तरह से विश्वास जीता है, आप 50 या 100 रुपए का योगदान भी दे सकते हैं। ये जो विश्वास जीता है, तभी इतने सारे एनजीओ साथ जुड़े, और जिन क्षेत्र में लोगों ने मदद करने की सोची है, वहां तक ये पहुंची भी है मदद।
Well, joining us, Amit Chandra, Chairman of Bain Capital India. Thank you so much for being with us. It's so important for people to participate, for companies to participate. How is this something which you believe is absolutely essential? Just getting out there, being part of a process of helping. At the end of the day, we may never know how many lives one person or one contribution saves, but it's the effort that counts so much, isn't it?
I think giving is really important from two perspectives. First of all, it's important because without giving, we cannot really build the nation that we want to see and that we aspire for. But I think it's also important because giving is about helping ourselves. It is about evolving our own personality into happier individuals and souls that we really want to be.
अमित जी, गिव इंडिया ने किस तरह का रोल अदा प्ले किया जिससे कि लोग आए, प्रोत्साहित हुए और उन्होंने अपना योगदान दिया?
So GiveIndia has for many years now already been the largest platform facilitating retail giving in the country, but it's done a remarkable job during COVID in really stepping up and doing that at a multiple of what it used to do in previous years. And that's I think terrific, because this is the time when our sisters and brothers who've been hit the hardest really need help at a scale which is unimaginable. And I think it's terrific to see GiveIndia being at the forefront of facilitating that in a highly efficient way. So I'm really very grateful to GiveIndia, to be doing that.
Fantastic to hear that, Mr. Chandra. Thank you so much for being with us this evening.
और अब हमारे साथ गोविंद अय्यर है, मैनेजिंग पार्टनर Gonzenda, बोर्ड डायरेक्टर GiveIndia. Sir, could you just tell us a little bit about the India COVID Response Fund by GiveIndia? What is the idea? इसके पीछे सोच क्या है पूरी?
So I think when the India COVID Response Fund was put together in March, the intent was very clear that we wanted to make it effective. We wanted everybody to come together, whether it's philanthropists, whether it's corporates, whether it's CSRs, whether it's foundations. And that was the genesis of the COVID Response Fund. And that, as was mentioned earlier, has been able to raise over 225 crores so far and hopes to get even further over the next 2 months.
Mr. Iyer, we believe the ICRF has been involved in a wide area of relief initiatives. What's the impact on the ground been like?
So you're completely right. The areas we've touched are largely livelihoods, humanitarian areas in healthcare, and today's program is all dedicated to healthcare. The livelihoods is really providing people who've lost their jobs, cash transfers to their accounts, and through that we've been able to benefit 500,000 people across the country. And the humanitarian efforts have largely been around meals, dry rations. And there, through the benefit of working with a lot of NGOs across the country, we've been able to benefit this to 2.9 million people across the country. And what's important to note over here is that we've done this across 115 cities. So it's a really widespread impact of contribution we've made across the country.
Yes, and of course, ICRF has GiveIndia's ground network of over 200 NGOs to tap into for the implementation bit. Who has some of your, who are,
That's right.
I would like to ask, the prominent partnerships been with?
So I just want to make this point that the 200 NGOs are big and small, but the most important partners on the ground are the NGO volunteers. Possibly 10,000 to 15,000 of these volunteers have been our partners. And there have been many NGOs we've worked with, 200 of them, and I think it'd be a disservice to single out any specific ones. But all I would say is that the collective pool of the 10 to 15,000 volunteers are really our partners to execute. I really want to thank them for their selfless and tireless efforts on the ground.
Mr. Iyer, thank you very much for sharing those views. Thanks very much indeed.
And now we have with us...
Thanks for this opportunity. Thank you.
Thank you. And now we have with us Somdat Chatterjee, Head of Corporate Partnerships, GiveIndia. What kind of a response have you got from corporates, philanthropic foundations and CSR funds in terms of support from the healthcare initiatives under ICRF?
GiveIndia has been working with corporates for corporate giving for the last 17 years. We have close to 150 corporate partners. In the last 4 to 5 months of COVID, we have started employee fundraisers with over 50 corporates, and we have cumulatively raised 6 crores to support the various relief initiatives that GiveIndia launched, ranging from giving sanitation kits to vulnerable masses, to food and dry rations to communities, to healthcare initiatives, as well as direct cash transfers to migrant laborers. We have worked with corporates like Ashirvad Pipes, Make My Trip, Uber, Nerolac to support people in their value chain with financial support, with financials. Like, for example, we have worked with Uber drivers, we have worked with plumbers from the Ashirvad Pipes community, we have worked with painters from the Nerolac community. We have helped all of them with financial support, direct cash transfers. We work with over 20 corporates like Marico, Genpact, Deutsche Bank to provide cooked meals to communities that have been hungry, starving because of the situation, because of lockdown. We've also worked with several corporates, good 40-50 corporates to support in healthcare initiatives, right from setting up isolation wards to PPE kits to face masks, shields, N95 masks, oxygen humidifiers, to setting up facilities in quarantine zones, to providing ambulances for mobile medical units. We've worked all of that with corporates. So yeah, this is how the corporates have come forward to support the COVID response work.
And it's great. It's great to hear about you're reaching out to corporates. But what about the corporates themselves? Have they been very willing to come forward? How exactly have they been getting involved?
There are multiple things that corporates have done. One of the largest being employee giving, and that could be either through payroll giving or through online fundraisers, or by starting their rewards and recognition programs and diverting the points that employees have in their kitties towards charities. We have TCS, BI Worldwide, Genpact, HP doing that for us. We've also had corporates do corporate matching. So whatever employees have contributed, corporates have done 100% match to support the COVID relief programs. We also have corporates that have supported extensively through CSR. It could be directly working with our projects or supporting events that we do for fundraising, like the I for India fundraising event we had done on Facebook, or the Sun Feast India Run as one event that's happening, that's getting flagged off today on the 15th of August, or the NDTV campaign. So corporates have come forward and supported these campaigns through their CSR funds. Corporates have also supported through foundation givings. We have Vodafone who supported through Vodafone Foundation. We have Axis Bank who has supported through their foundation to these relief programs. We also have HNI, CXOs, management, people coming forward and doing personal contributions, individual contributions, like Sundar Pichai coming forward and donating 5 crores. Similarly, we have several such HNIs and CXOs who have come and pledged their donations. So these are the various ways corporates have supported us.
सुमलता, बहुत-बहुत धन्यवाद जुड़ने के लिए और अच्छा लगा सुन के कि उद्योग जगत भी मजबूती से शिरकत कर रहा है.
Well, we've got a wonderful guest joining us now, Nidhi, Atul Kasbekar, photographer and film producer. Thank you, Mr. Kasbekar, for being with us. Now, you started a donation drive that saw over 20,000 odd kits being delivered to 50 hospitals all over India. What inspired you to do this?
Thanks for reaching out, guys. It's nice to be here. At the start of this, I think people were like me, were generally clueless about what's going on, and I was reading a lot about it, and what seemed to be common is the fact that we weren't protecting our frontline medical staff like we should. Maybe it was an oversight, or I don't know what, but and any hospital unit basically has a doctor, as I understand, has a doctor, a couple of interns, residents, nurses, ward boys, etc. And if one of them gets COVID positive, which is a great likelihood because you're dealing right on the front line with patients, then the entire group is quarantined. And what was disturbing to me and seemed like a medical anarchy about to happen was that our hospitals at that point in time, in the early days, were functioning at like 20-30% capacity, which is really, really dangerous. So I have a simple philosophy in life, which is to either lead, follow, or get the hell out of the way. And there's a producer colleague called Manish Mundra who was doing some phenomenal work getting PPE kits to where they were required. And I just thought I'd follow what Manish is doing and help him out, in the process, and that worked out well. I'm really grateful to people like Vidya, Farhan, Dia Mirza, Veer Das, Harsha Bogle, and Ali Fazal, Richard Chadda, Mrinal Thakur, lots of stars who came on board to help. I mean, I basically acted as the, somebody they could all trust, and they put out a word on a celebrity platform called Tring. So, if I ask you to give money, you will basically give money because I harrowed you to do that, right? But if you're getting some gratification in return, which is a direct thank you from a star, either on video or a phone call or a mention on their social media, then that's a big deal for a lot of people.
Sure.
So we basically, tied up the back end. So, when people gave money, depending on how much they gave, they got a phone call with a star or like a shout or a mention, which worked out great. So I honestly believe you should have some kind of gratification when, you ask for people to donate something.
Sure.
And, my sense of geography turned out really good at the end of it. I didn't know, for example, a place like Zahirabad existed. So, we had messages from all kinds of small hospitals wanting material.
Yeah. अतुल, मैं आपसे पूछना चाहती हूँ, आप एक फोटोग्राफर भी हैं, आपने मूवीज भी बनाई हैं, कौन से दृश्य आपके जहन में उनका असर पड़ा? आपने माइग्रेंट्स को भी जाते हुए देखा होगा, लेकिन अब जिस तरह से कोविड पेशेंट्स आते हैं, हमारे कोरोना वॉरियर्स जाते हैं, उस लिहाज से क्या असर है आपके जहन में सबसे ज्यादा?
देखिए, हमारे फौजी भाइयों और बहनें जो फ्रंट पे हैं, अगर आप उन्हें इक्विपमेंट बंदूकें, बुलेट्स एक्सेट्रा न दे तो वो अपना काम नहीं कर पाएंगे, ये जाहिर है। तो हमारे मेडिकल स्टाफ जो है इस युद्ध में ये हमारे सिपाही हैं, और ये जरूरी होगा कि आप उनको प्रोटेक्ट करें। सो आई डोंट थिंक प्रोटेक्शन जो था वो उनको उतना मिल रहा था। तो आई जस्ट थॉट कि यू कांट हैव डॉक्टर्स सिक, दैट्स क्रेजी, simple as that. So
all right, Mr. Kasbekar, thank you so much for being with us, and it's great to see your contribution. Well, I want to go back to Dr. Roy, because one of the points that you were actually mentioning, and we're all asked this on a daily basis, how long is this going to last, the COVID situation? Is it getting better? And you mentioned how in the UK it was, what, 0.8 in terms of the R factor. Where are we now? Right. And is there any way of predicting when we're going to go beneath that 1.0 threshold, as it were?
I was just saying, yes, there is some encouraging news. And we've done state-wise analysis, which we'll be publishing. This is calculating the R in India, and it is coming down. R is used all over the world, not much used in India, but all over the world it's used to judge how quickly it's spreading or how slowly. And you can see the R is coming down to from 1.2 to about 1.07 right now. And that's a very, very good sign. But still, the primary target must be that R falls below 1. Then the spread is really slows down. And the worry is that you can go down like this and then you can have a second spike, like you've seen in Spain and you're seeing in France, and even in New Zealand, the great success story, New Zealand and South Korea, we're seeing a new small second spikes. Now this R calculation we've been helped by wonderful Professor Sitobra Sinha, who does this in a much more complicated way. So this is a simplified version of what he does. He does much more sophisticated modeling, but this generally gives the trend. And even though we're seeing this, Vishnu Nidhi, we must not lower our guard, because as I mentioned, there are second spikes. So just in honor of our doctors and our nurses and our medical staff who are facing death every day, risking their lives. Let us not lower our guards. Let's keep fighting. When it will end is when we really bring that R factor down to 0, and we are a long way from that, but encouraging signs for the country. And we will be publishing state-wise how some states are doing better than the others and who needs to be a little more careful. And you will see certain states already seeing a second spike.
Okay.
Vishnu.
All right, absolutely fascinating over there. Let's just hope there are no more spikes. That's the last thing that we need over here in India. We'll come back to you in a little while from now, but we're now joined by Ingrid, Sreena, the director at the Center for Social Impact and Philanthropy at Ashoka University. Thank you so much for joining in today. Do give us more in terms of an idea of how GiveIndia ensures that there is complete transparency in the India COVID Response Fund initiative, transparency being so critical.
In the time of a crisis like this pandemic, both the demand from donors surges. I mean, there's been 3.5 lakh donors have donated to the fund, as well as the number of NGOs doing work on this issue skyrockets. So literally 70-80% of all NGOs across India say that they're doing some work relating to COVID relief. And so what GiveIndia did to cope with this surge in both, if you will, supply and demand, was to create a 20-person advisory board comprising of really eminent people across business, philanthropy, and civil society to oversee the whole process, define the mandate for the fund, define the fund's priorities, and then continue to monitor the performance of the fund. Within that advisory board, there's a 3-person steering committee, of which I am part, which meets weekly. And what we do is review proposals that have already been vetted by the GiveIndia staff to meet their criteria, and then we examine them for their fit with what the fund's purposes are. And so, and then we report back to the board on this. So in a sense, there's a kind of a 3-step vetting of every program that receives money from the fund.
Right. Yeah, right. Ingrid, Sreena, thanks very much. You know, people say that Indians are not that generous, but we've noticed Indians are extremely generous when they trust where the money is gone. And your ICRF, the India COVID Response Fund, is a trusted fund. So I think all our donors would like to know, how do you keep track of the funds, and how will you inform donors of how their money is actually being spent?
So all disbursements are reported weekly on the ICRF website and through social media accounts of ICRF. We, as I said, review it as a committee weekly, and the advisory board reviews it fortnightly. Donors are separate. So there are 2 stages. One is, of course, just letting them know how their money is being used, which is just information. And then at the second stage, to give them impact reporting. So it takes about 6 to 7 weeks for NGOs to be able to actually report back and say, these are the households that we cover, these are the number of children that we reached, this was the impact of your money, with the sort of evidence of that impact. And so at the second stage, donors receive impact reports.
All right, thank you very much, Ingrid, Sreena, for being with us. Now, Dr. Roy, we've got a great announcement to make. And it's the first of what we hope are many. This evening, HSBC India, thank you for your generous contribution, 50 lakh rupees towards the Caring for India campaign.
50 lakhs, did you say?
It's a great start this evening.
That is a great start. Thank you very much, HSBC. Thank you.
Well, joining us now, Dr. Davey Shetty, founder of Narendra Health. Thank you very much, Dr. Shetty. Now, COVID looks like it's going to be here, unfortunately, for a while, and all of our lives have quite clearly been changed. Who knows, perhaps forever. But what can we do to keep this infection at bay, to curb it as best we can?
The most important thing to control COVID is the responsibility of every citizen to protect themselves. If they protect themselves, if they prevent themselves from getting the infection, they essentially break the cycle of spread. break the chain of spread. So they will be doing a great service to themselves and to the society. And from the policy point of view, we have come to a very clear picture that COVID is now moving from big cities to small towns, districts, talukas, and villages. So we need to really educate them, create good healthcare infrastructure.
Thank you very much, Dr. Shetty. We have great faith in NGOs because they are on ground. They know what's happening. They know the details. But you are as competent or more competent in explaining to them what they can do. So how can GiveIndia continue to build on its efforts in the healthcare space?
India's biggest problem is the delivery of healthcare. Unfortunately, in the last 20 years, government hospitals are not living up to our expectations. It is very, very important that the civic bodies get together and try to help the public hospitals bring in more transparency, more accountability, and also support them. If that happens, 600 to 700 government hospitals, district headquarters hospital, and few thousand taluka hospitals will become vibrant. They need professional help to streamline their operation. And that kind of a help, guidance can be provided by organizations like GiveIndia. And when that happens, if the government hospitals become vibrant, believe me, we would have transformed the healthcare of the country.
Absolutely, Dr. Shetty. So important for us to be aware of what exactly our situation is, to help ourselves in order to fight this. Well, joining us now, Sandeep Sibal, CEO of the Fourth Frontier, board member also of GiveIndia. Thank you so much for being with us. Now, we've heard about ICRF's involvement in an array of interventions. Tell us why the focus on healthcare.
Yeah, thank you. When COVID first hit, we recognized the fact that the impact it had on the country had multiple dimensions to it. It was, of course, people getting infected, like Dr. Davey Shetty mentioned, and the healthcare aspects. There was also the question around humanitarian crises that were being created with migrants moving from cities to their hometowns and so on, and there were livelihood issues. So we recognized that this was a complex problem, and we decided to focus on many of these areas. But healthcare, we felt, was an area that the leverage was perhaps the greatest. We had the benefit of the fact that the COVID disease had already spread in many other parts of the world. And when we studied cases like, for example, Italy, we realized that it was the failure of the healthcare infrastructure that caused a lot of the complications downstream. And so within healthcare also, we looked at how can we protect our protectors? How can we protect healthcare workers? So we began with that thesis in mind, and we focused on the hotspots. We looked at metros, specifically Mumbai. If you recall, when it began, Mumbai had something like 25% or more of all cases in India. We looked at New Delhi. We looked at Ahmedabad. We looked at Chennai. So we looked at these hotspots. And we said, what is it that we can do to at least firstly protect our healthcare workers? The doctor-patient ratio in India is not the best. So what can we do? And at that time, if you recall, many of the hospitals in Mumbai had to shut down for a period of time because doctors were getting infected. Now, this problem was exacerbated by the fact that there were just not enough PPEs available. So it was a complex problem. We had to supply these PPEs. We had to ensure they were getting to the right places. There was a last mile distribution problem. So we decided that this was an area that we would take on a priority.
जी संदीप जी, मैं आपसे ही जानना चाहूंगी, जिस तरह से आपने कहा कि आप हॉटस्पॉट्स पे आप लोगों ने तवज्जो दी, दिल्ली में भी और मुंबई का आपने जिक्र किया, तो ये इस वायरस के बारे में बहुत कम जानते थे हम लोग, जिस तरह से अब 8-9 महीने पुराना हो गया है. तो आपकी जो स्ट्रेटजीज थी, आपकी रणनीति थी, किस तरह से बदली कि मदद किस तरह से अलग तरीके से दी जाए?
देखिए, मैं अंग्रेजी में जवाब दूंगा.
बिल्कुल बिल्कुल बिल्कुल.
बुरा मत मानना. the issue of the strategy, and how it evolved is a very difficult one, because I would say there are two aspects to it. One is the fact that the geographical locations have been evolving. So while the disease started in metros, it is being spread now to tier 2 towns and unfortunately to villages as well. So it was a moving target in terms of physical location. At the same time, there's also the problem that it's not just protecting healthcare workers. Upstream from that is the question around how can we reduce the infections by screening, people with symptoms. So we actually went down there and we said, well, for example, in certain parts of Mumbai, difficult to access areas, especially with the monsoons coming on, we went deep into pockets where people were not coming to the hospitals to get themselves tested because it's very difficult to do so. So we had ambulances, mobile medical units that would go into these areas, screen folks, and actually bring back people who had symptoms for further testing, for blood tests and so on. And those who were found to have infections were then treated by the public healthcare infrastructure system. At the same time, we also realized that downstream of this, there were treatment issues. For example, plasma treatment, which you'll hear a lot more about later in the show. The issue was, even though we have in India right now about 1 million folks who recovered from plasma, very few plasma donors. So we try to solve that problem.
Yes, that is a worry. It's amazing, Sandeep Sibal. This is Pranoy here. Thanks very much for joining us tonight. I just wanted to ask you, it's so impressive how you keep changing and analyzing the situation and implement. Can you give us 2 or 3 actual examples of the impact of these interventions that you've done?
I think that's an interesting question. Well, I think in terms of lives saved, it would be difficult to quantify this, but I can tell you that since we begun, we've supplied about 1.5 lakh PPEs to health workers around India, about 250,000 face masks, about 4.5 lakh gowns, and we've addressed the needs of 50 plus hospitals in these metros. And we've applied more than 100 plus ambulances. So we've done a lot in those terms. In terms of impact, we've also done things that are a little non-standard. During the monsoons, for example, in Mumbai, the train system had shut down, right? The locals were not flying. So we decided to actually have bus and healthcare workers from distant places like Thane down to hospitals like Sion and Nayar, so that, we could actually have a vibrant healthcare infrastructure. So we have done interventions of this kind as well.
Right. Right. No, that's incredible work, and thanks for sharing a lot of those accounts with us. We also have another fantastic guest joining us right now. Dr. Ravi Wankhedkar is the treasurer of the World Medical Association, president of the SARC Medical Association. He's also a former national president of the Indian Medical Association. You will not find more experienced people in this area. Sir, the pandemic has been the biggest wake-up call for the world. We realized how much governments and societies must focus on healthcare. Tell us what more can be done in this area.
First of all, thank you NDTV for recognizing the role of healthcare givers and running this show, which will help all our healthcare givers throughout the country. Especially my humble request, before I answer your question, would focus on the general practitioners, the family physicians and the paramedical workers who are in dire need still of lot of personal protection equipment and other support.
Right.
As rightly said by Dr. Roy, that our effective reproductive rate is coming down. It's a good sign. But still, one has to understand that this is a patchy pandemic, wherein geographical areas will come up and down, but everything is still interconnected. You can't say take a Mumbai and MMR region. Even though we are saying that Mumbai is the regular cases are decreasing, but still the mortality rate is very high. But if MMR region is not controlled, then Mumbai will again flare up. And same thing will happen in other areas also. Unfortunately,
Dr. Ravi Wankhedkar, you put it very well. It's a patchy virus. I mean, you see in America, New York has really done very well. Now the whole southern states are coming up. Similarly in India, some parts are improving, some parts are getting worse. So we have to keep watching. You're quite right. And this is actually a time for prevention, right? We've learned a lot since 4 or 5 months ago. And do you all feel like the data is showing that wearing masks is key, and not masks below the nose or sometimes, but a proper use of masks, not to protect yourself only, but to protect others as well. How do we make sure that more people wear masks in India, and there's a mask awareness like we find in many Asian countries?
Absolutely right. You have hit the nail. Masks are to be made compulsory, and it should start from the top. All the celebrities, all the opinion makers should wear proper fitting, regular mask all the time, everywhere. And this should not only be compulsory, but a massive public awareness campaign. And here all NGOs can chip in. Unfortunately, what we are lacking in this pandemic is the political class at the ground level is not seen as it was seen in other disasters like earthquakes or floods. If they come on to the Mohalla community leaders, the local postmaster, local school teacher, local corporator, local Shiv Sena Pramukh, or its counterpart, if they come onto the streets and make aware the community, I think that will be the most effective way of making people wear masks. Masks are the only vaccine which is available at present.
Really important. Masks, the only vaccine presently available. Professor Vanketkar, thanks very much for being with us. Mohit Bhatnagar, Managing Director of Sequoia Capital, and Shekhar Kirani, partner at SL, join us. Thank you very much for being with us. Let me ask you to provide a little bit of context here. Sandeep, tell us a little about GiveIndia's partnership with ACT.
Right at the outset, we realized that COVID was a complicated challenge. It was not something that could be solved with just a single approach. And we realized that partnering with India's vibrant startup ecosystem was important for two reasons. One was its ability to nimbly respond with speed and alacrity, with solutions that were economical, but also to come up with novel, innovative, technology-led solutions. And we felt that this sort of a symbiotic partnership between GiveIndia, with our reach across the country through our NGOs, and on the other hand, ACT, which is a collection of top-tier VCs and their portfolio companies, would be a great and strong combination. So at the outset, when we had a lack of PPEs, we actually spoke with ACT. We presented our case to the ACT grants team, and we decided to pool resources to come up with a joint fund that we've now used and effectively built to address challenges around delivering PPEs, around home quarantining solutions, as well as plasma therapy. So we're very grateful for Mohit Bhatnagar, for Shekhar Kirani and others from the ACT team for being a strong partners of ours right since the beginning.
जी शेखर, मेरा सवाल आपसे है कि अब तक जो इम्पैक्ट कैसा रहा है ACT का?
See, the impact has been phenomenal. We started early before the disease got hold in India. So we were the very early to build prevention technology. So we got a lot of war room technology, as well as a significant number of drone tech, contact tracing to lots of states. And as the disease moved to the next level, we had the COVID helplines at various governments so that the panic among the people can be avoided. More than 4 lakh plus calls have been processed by ACT grant given companies. Then as it started to move further, we said N95 and PPE is the critical need in India because it was all being imported. So we got at least 30% of the capacity of India that is able to be manufactured with indigenous products by giving grants to the right set of people so they can scale it. Then became the testing. Testing was just starting out. Again, kits weren't available. So we gave grants to 7 to 8 testing companies that created not only the equipment, but also testing kits. In fact, 50% of the Indian testing capacity is given by the ACT grants team. And while all this is happening, we felt oxygen solutions are missing in India, which is called HFNC, which was very well used in Italy and in US. So we kind of encouraged that 2-3 manufacturers to indigenize again and produce. And that is helping, at least now, in most of the states are ordering these devices. So what
That's amazing work, actually. Congratulations. It's very, very inspiring to hear all that. In fact, if I can just ask Mohit Bhatnagar, I mean, all this work that's been happening and how the priorities have changed over time, it's a moving, the way you have an impact is changed during the course of this pandemic, right?
Pranay, I mean, look, we started off like most, first just focusing on PPEs, which is providing protective equipment to our doctors at the healthcare, front. We then moved our efforts towards testing to just try and get a lot more testing done across India. But frankly, right now, our focus is on 3 very specific things that we found to be scalable solutions to really fight back the spread of the disease. The first one is home management. The good news about this is about 85% of people who get COVID can be treated at home, but we cannot let them panic. So there is a whole host of telemedicine solutions where volunteers, doctors, call patients, help them understand the protocol, manage their temperature, their symptoms, and allow them to stay at home while they recover. The second is for those patients that need to be transferred to some of the medical facilities that the government is running, we've actually helped with oxygen therapy solutions. If you can get folks onto oxygen solutions, whether they're the low flow type on concentrators or just oxygen cylinders, or the higher flow solutions like Shekhar talked about, like HFNCs, that's been a second massive focus for us, and we've evolved as the disease has evolved. Something that we're really excited about that we think will be helpful for India as the disease spreads to small towns and cities is to provide a remote ICU capability. Think of all the small towns and cities of India that don't have intensivists. How can we have a central set of intensivists sitting in the larger cities of India, remotely managing with doctors locally present, folks there?
Yeah. Excellent. Yeah, good point actually, a great idea.
मोहित, मैं आपसे यही जानना चाहूंगी, एक तो आपकी जो मास्क अवेयरनेस, डिस्ट्रीब्यूशन अवेयरनेस के बारे में, और जो आपने ये रिमोट आईसीयू की बात की है, किस तरह से संभव हो पाएगा, इसके लॉजिस्टिक्स क्या होंगे? Have you worked on that strata?
Absolutely. You'll hear today on this very show from our partners like Cloud Physician and Pretty ICU. They have now deployed hundreds of beds all across Maharashtra and the smaller towns and the smaller cities across India. The way it actually works is you actually have intensivists who tend to be actually sometimes more senior doctors who sit remotely, use cameras to be able to get access and use sensors to get access to some of the patient data, who then work via telephonic links with doctors who are locally present there in order for having them administer help and support to the patients. In this way, we can actually have one doctor who normally would have supported only 15 or 20 patients if he was physically present to actually support closer to 75 or 100 patients. And that scale is what will help us service this need in smaller cities and towns of India.
Right. Well, Mohit and Shekhar, thank you both very much for being with us and sharing all of that. Before we introduce our next guest, here's a look at a video from the mask awareness campaign that you just heard Mohit speak about.
10 किलो का यूनिफॉर्म, 12 किलो का एम्युनिशन, 15 केजी का रक्सैन। एक सोल्जर जंग में दुश्मन से ये सब पहन के लड़ता है और आप एक मास्क पहनने में हिचकिचाते हैं। यही तो है आपका हथियार कोरोना से लड़ने के लिए। तो एक सोल्जर आपसे कह रहा है, बनिए कोरोना सोल्जर, मास्क पहन के। इस जंग में जुड़ने के लिए IamACoronaSoldier.com पे रजिस्टर करो, मास्क पहनो, कोरोना सोल्जर बनो। मास्क का वार, कोरोना की हार।
So we have with us Priyanka Prakash. She's the head of online giving, marketing and partnerships, GiveIndia. Priyanka, my question is, what is a healthcare fundraiser and who does it actually help?
Thank you. We all know that when families face healthcare emergencies, they mostly also face a lot of financial distress. With GiveIndia fundraisers, what you can do is you can raise donations from donors who are willing to help so that you can pay for your medical bills without having to take loans or go through a financial distress. We can, as a nonprofit, issue tax exemption certificate for donors in India, US, and UK. We also accept donations from around the world. Being a nonprofit platform, we are able to do this. We also make sure that all the donations, all the donors get updates for all the donations that they are making. Our platform is free, which is that we don't charge any platform fees, so that maximum use of the funds is being going to the fundraiser themselves. So that's what GiveIndia fundraiser does to support people who are in healthcare emergencies.
Priyanka, how do you reassure your donors that this is all above board and that the money will be used correctly at the right place?
Sure. So one of the founding philosophies of GiveIndia has been trust and transparency. That's been the most important cornerstone for us. And when we take up any fundraisers on our platform, we make sure that we verify the credibility of the requests, go through all the documentations, do a very unbiased review of those to make sure that the reason for fundraising is very real. And we don't just stop there. We ensure that the fundraisers are also providing updates to the donors, so the donors understand that the donations that they are making are actually making a real impact. So trust and transparency is actually very important for us, so that we are bridging the any trust deficit that donors have in their mind.
Thank you so much, Priyanka, for joining with us. Thank you so much. Well, the threat from COVID-19 pandemic is not yet over, and the key is to maintain the strategy of aggressive testing as part of a GiveIndia initiative to mobile medical units operate in the most densely populated urban slum areas of Mumbai, screening the residents for COVID-19, identifying and isolating potential carriers and providing free medicines, masks and soaps during the pandemic.
डॉक्टर्स फोरयू की तरफ से रफीक नगर में मुफ्त आरोग्य शिविर आयोजित किया गया है.
Announcing free medical services for the residents of this densely populated slum located in Govandi in Mumbai is this mobile medical unit, an initiative of GiveIndia. Residents say medical care is difficult to access as clinics are shut, with many doctors having tested positive. This mobile medical unit fills the gap, screening residents for COVID-19. They also identify and isolate potential carriers and provide free medicines, masks and soaps.
Once the screening is done, whoever were required referrals was sent to a health post, the government health post. From there, the swab tests were taken, and then the patients, whoever were found positive, was sent to the isolation wards.
जब वो लॉकडाउन चालू था तभी यहाँ पे बहुत प्रॉब्लम थी, दिक्कत बहुत थी. कोई डॉक्टर नहीं आ रहे थे यहाँ पे. मतलब हम लोग बहुत परेशान थे कि हम क्या करें जब बुखार आ रहा है, सर्दी हो रही है. तो फिर ये डॉक्टर फोरयू की जो टीम है वो यहाँ पे आती थी, टेम्परेचर चेक करते थे, पल्स ऑक्सीमीटर चेक करते थे, हमारा हमें मेडिसिन देते थे.
GiveIndia and its implementation partner, Doctors for You, have deployed 6 mobile medical units which screen up to 300 people a day and more than 16,500 screenings so far. With cases of the coronavirus on the rise, these mobile units are helping curb the community spread of the virus.
Well, joining us now, Dr. Rajat Jain, President for Doctors for You. Thanks very much for being with us. How does the mobile medical unit actually function?
Now, what we typically do in a medical mobile unit is we place one doctor, one nurse, and 4 to 6 health assistant in that. So we go to a particular area. Then these health assistant who are in the MMU, they do a house-to-house survey, and a screening is done using the infrared thermometer along with the pulse, the saturation monitor to see whether they are having a hypoxia or whether they are suffering from any fever. And on the basis of that, they are referred to different centers.
Doctor, what kind of an impact have you seen of this door-to-door screening?
So with this MMUs, till now in Mumbai only, we are able to screen more than 16,000 population. And we know that the screening and the testing is one of the biggest intervention in this COVID area. And using this screening, we were able to find out more than 55 patients who were having COVID positive, and they were having hypoxia. And now with our intervention, they are being treated in the hospitals, and we were able to save them. Otherwise, because of the hypoxia, they might have worsened, and we might have lost all of them. Similarly, we conducted these screening programs at a lot of pediatric places also, because we know that though in pediatric patients the disease doesn't get severe, but they act as a major source of spreading the infection to the other people. And a lot of pediatric age group COVID positive patients we were able to find out, and they were being managed in the treatment facilities. So we believe that this is a major impact that it has created. But since it was only done in Mumbai, and now we know as the disease is spreading, it is going to tier 2 cities, it is going to the non-metro cities also. So we are planning to extend our interventions to the non-metro cities.
बहुत बहुत शुक्रिया और अपना भी ध्यान रखिए डॉक्टर साहब आप। और आइए आगे बढ़ते हैं। द फर्स्ट ऑफ द हेल्थ इंटरवेंशंस दैट वी आर रेजिंग फंड्स फॉर टुडे इज डिटेक्शन एंड प्रिवेंशन, door-to-door screening that aims at catching the infection at an early possible and preventing a further spread. Joining us to talk about this is Neha Joshi, Head Non-Profit Partnerships, GiveIndia. Neha, my question to you is, why did GiveIndia start this program for detection and prevention?
Okay, so we started this program somewhere around mid-June. Till then, we had already done extensive work for COVID relief, for healthcare, as well as for food and livelihood support. However, our approach till then had been very reactive, in the sense that we were supporting people who were already impacted by the situation, and we wanted to explore more ways to, more avenues to, add value to, add proactive value to the situation on the ground. With that in mind, we identified screening and testing as an area where such a support could be highly leveraged, and it could create huge impact. So we all know what testing is, but since we cannot test the complete population at large, screening comes into picture, where we check for any infection, check for any factors, risk factors, and only a potential set of cases is then referred for testing and eventually tested. For screening and testing, we went ahead with this intervention with two major goals in mind. First, to identify the infection in anybody who's COVID positive early on, so that before the situation became severe. Second, because these people were immediately sent for treatment and immediately isolated from the community, also avoid very early in very early stages the community spread, thus with an idea of flattening the curve in the long run. So with these ideas and goals in mind, we launched this program.
Sure. Neha, tell me, can you tell us how the project was implemented? How did you identify the areas where you wanted to do the door-to-door screening?
So as I said, it started somewhere in June. That was a time when Mumbai was seeing very rapid increase in cases. And at the same time, we were very actively involved, very actively working in Mumbai, and we had a lot of connections with doctors, volunteers, as well as implementation partners in the city. I think these two factors combined, Mumbai just became the most suited location for our intervention. Once the location was decided, we went ahead with our partners, Doctors for You, and identified these high population density locations in Mumbai, areas like Dharavi, Mankhurd, Vashinaka, Dadar, etc. And the idea was to go deep within these communities, go door to door as much as possible, and screen people. To do that, we deployed vans, which we call mobile medical units, where there is some equipment, medical equipment, as well as a doctor, as well as some healthcare staff who are a part of the whole entity. The idea was for these vans to go deep within the communities, even cover a lot of regions in these areas. We started with 2 mobile vans in June. added 4 more in July based on the success that we had seen. And right now, 6 mobile vans are active who go to all these deep, highly densely populated areas in Mumbai and do screening. We've seen huge impact of this work, and looking, as Dr. Really rightly said, that we want to expand it not just in other metros, but also to tier 2 and tier 3 towns where we are now seeing a rapid increase in cases.
नेहा, आपने जो हमें समझाया उससे वाकई में समझ आता है कि एक एक कदम, एक एक मोबाइल वैन जुड़ती है, किस तरह से लोगों की मदद होती है। लेकिन मैं आपसे ये भी एक सवाल पूछना चाहूंगी कि एक तो हमारे सफाई कर्मी भी हैं, तमाम लोग हैं, जो ड्राइवर्स भी हैं, एक हमारे फ्रंटलाइन वॉरियर्स हैं, वो भी आपकी नीति में, रणनीति में शामिल रहे होंगे।
बिल्कुल बिल्कुल। हमने सिर्फ we just did not go into deep into communities to serve there, और हमने सिर्फ हेल्थ केयर वर्कर्स के साथ ही काम नहीं किया है. We are connected with a lot of non-profits who work specifically with these frontline workers who are actually our COVID warriors. We've supported them with a lot of protective equipment, right from masks to face shields to sanitation supplies, so that they can carry out their day-to-day work. It doesn't hinder their livelihood. So supported them in that way.
Absolutely, Neha. थैंक यू सो मच नेहा, आपने अपने सारे एक्सपीरियंसेस हमसे शेयर किए और लोग समझेंगे कि गिव इंडिया किस तरह से काम करता है, उसके काम के बारे में हमें पता लगता है. तो बहुत बहुत धन्यवाद आपका नेहा. Another area of intervention has been protection, to protect healthcare workers in the front line and in the back end, in urban hospitals and rural health centers, doctors, nurses, ASHA workers, Anganwadi workers. It has been an ongoing effort since the pandemic began, and it needs to continue because every day people who fight to keep us safe are exposing themselves highly to this infectious virus. This is how it all began.
When the pandemic began, we responded by distributing dry rations and meal kits to all the workforce which suddenly found itself at home. Then a friend's daughter, a medical student, asked me if we could distribute masks to her seniors who were down to their last 20 masks. So we managed to get the suppliers and responded to that. Then through word of mouth, we realized that many doctors and interns were asking us for PPE kits, for eye goggles, for masks. We started our fundraiser, and that's when GiveIndia stepped in. There was one person who was in charge of just looking at the product. Since it was a new space for us, and GiveIndia was also very particular that the right product, the best product in the market, should reach the hospitals. So we had somebody looking at whether the PPE kits were Citra certified, whether the masks were NIOSH approved, and we realized that the doctors were actually in a battlefield, and we could respond because of the solid support given to us by GiveIndia.
तो आज हम लगातार अपने डॉक्टर्स को याद कर रहे हैं. हम जानते हैं कि 100 से ज़्यादा हमारे डॉक्टर्स ने जान गंवाई है. Let us now hear from the medical community on how this intervention has been helping them.
We were in desperate need, so a few colleagues of mine, we were approached by Manji Foundation with association with GiveIndia, and they have helped us since. Till now they have donated around 1,000 masks and around 300 to 500 PPE kits.
For a pandemic of this magnitude, every help is required from the citizens, from the NGOs, especially in the beginning of the pandemic when systems were not yet organized, our experience with the disease was less, and there was a huge shortage of PPE. And at that critical time, GiveIndia and through Manji Skilling Foundation stepped into the breach and was able to provide us with PPEs, disposable bed sheets, N95 masks, which were very severely needed at that time. And then through the months, they have continued to help with whatever the hospital needed and whatever the health system needed. So whether it was infusion pumps or ventilators or HFNCs, so they have helped us a great deal, and it has motivated us to work harder and to work braver.
When this COVID pandemic started, we realized that the guys on the front line, they need some more support. So with my wife being an intensivist, we decided to do something to boost their immunity as well as help protect them at the front lines. So we started procuring vitamin C, vitamin B16, vitamin D, medicines and personal protective equipment, N95 gloves, sanitizers, a lot of things. So for that, our cash requirement was very high. So we started sending SOS messages for help to friends, families. And one thing led to another, and then we got in touch with GiveIndia. Now, GiveIndia really helped us out because they kind of put in a bulk of the money to source PPE kits. So this really helped us supply to the police department.
Residents in Cooper, I remember Seema and me interacted and we sent in 300 body bags because they said, Madam, desperate hai mala body bags paije. Then we had these residents in Sion, I think they got Enerzal and they were like so happy. One of the very interesting things was that at this time we learned testing PPEs, are they correct, what is CITRA guidelines, what is NIOSH guidelines, what is DREDA, because these were fabric industry. So I think we went a lot into also validating the products because Manji and GiveIndia were very particular about quality. The idea was we wanted to protect the healthcare workers. The clarity was very clear. No healthcare worker should get sick.
During this period, Dr. Suja, who is a pediatrician, and myself, we came across the primary health workers who are actually working in primary health centers of BMC and those who go from door to door for surveillance. They are using just their dupattas and some ply mask, for while they are visiting the patients. GiveIndia and Manji Foundation helped us a lot in distributing the PPEs, gowns, caps. So basically, when the frontline worker, when they are well equipped, actually they can work more fearlessly.
They helped us for PPE kits, they helped us for masks, they helped us for equipments, ventilators and infusion pumps and intensive care goods which were needed. And this was a substantial help by them to us, which made our life really easy.
There was a point when some of our technical staff and doctors were spending 4 to 6 hours on the road just to make it to the hospital to provide services for the patients over there. And this was taking a toll on them. So they reached out to me and said, is it possible for us to get some sort of transportation? And I told Seema that, you know what, this particular lot is really having a tough time. Can we do something about it? And that's when they reached out and crowdfunded with other donors, and we have a bus which is still ongoing. So this is the second month for people from the central line, and it makes life so much easier, especially now with the rains, the floods, we've gone through so much. Simultaneously, there's something called an NIV mask, which we use. Non-invasive ventilation is the core of COVID treatment. And the NIV mask is something which is needed all across the board. So we decided upon getting NIV masks, which could be used in all the ICUs, and they were generous enough to contribute 800 of them. Truly, Manji's Skilling Foundation for Development and GiveIndia have been wonderful in this journey, and at Nair Hospital, we'll always be grateful to them.
अब हमारे साथ बेहद खास मेहमान दिया मिर्जा, एक्टर, प्रोड्यूसर, UNEP की गुडविल एम्बेसडर हैं. Diya, first, it has been over 6 months now. Is dealing with the new normal getting a little easier?
Yes, it is. I mean, I think one of the most incredible qualities we have as human beings is the ability to adapt. And I think we are all learning to adapt to a new way of life.
Diya Mirza, thanks so much for joining us here. I must say it's amazing how you really come alive and work so hard at times of crisis like this and helping others. In that case, and your DNA is a bit like NDTV. This is in our DNA, to try and make a difference in a crisis situation. Aren't you impressed at how much work people of India are doing, the NGOs are doing, and of course you with them? We are really bowled over and impressed by your work and the NGO's work.
Oh, absolutely. Thank you, Dr. Roy, for having me and for doing all that you do and you continue to do and making the difference that you do. It's always a pleasure to join you. I don't think we know how to see a problem, witness a crisis and not respond to it from a place of empathy and not respond to it from the attitude that we want to be a part of the solution. I think the last few months have been extraordinary. The level of human crisis that we've experienced has been very, very challenging for people across the board. But what has been truly motivating and inspiring and has really helped me during this time is the incredible work that citizen groups are doing, that organizations are doing, that individuals are doing to be a part of the solution, to help people. And I think we must all be very proud to be witness of such altruism.
For joining us with that, and thank you so much for being such an important participant in the process of helping others.
Thank you. Thank you for doing what you are.
Well, joining us now, Satyendra Jain, the Minister of Health for the Government of Delhi. Satyendra ji, how do you see the COVID-19 situation evolving in Delhi at this stage?
नमस्कार। देखिएगा, सबसे पहले तो दिल्ली में बताना चाहूँगा कि सिचुएशन अभी काफ़ी कंट्रोल में लगती है। सबसे पहले दिल्ली जो था सबसे ज़्यादा इसमें फैला कोविड, और उसका रीज़न सबको पता है कि जितनी भी इंटरनेशनल फ्लाइट्स थी वो दिल्ली में और मुंबई में 2 जगह आई थी। तो मैंने बार बार बताया कि भाई सबसे ज़्यादा हमारे यहाँ फैलने का चांसेस था, तो दोनों जगह पर सबसे पहले फैला। बट आज सिचुएशन काफ़ी कंट्रोल में। एक टाइम ऐसा था कि एक दिन में 4000 के करीब केस पॉजिटिव आ रहे थे। अब हमारे पास पॉजिटिव केस 1000, 800, 1000, 1200, 1100 इस तरह से डेली आ रहे हैं। पॉजिटिविटी रेट जो कि बहुत बड़ा इंडिकेटर है, एक टाइम पर 30% से भी ज्यादा था, जो कि आज 6% रह गया है। तो पॉजिटिविटी रेट जो है ज्यादा बड़ा इंडिकेटर होता है कि भी कितने लोगों का पॉजिटिव केस आ रहा है, क्योंकि आजकल हम टेस्टिंग लगभग 20,000 के 18-20,000 टेस्ट रोज कर रहे हैं, तो उसके अंदर 1200 के करीब 1100-1200 पॉजिटिव आते हैं। एक टाइम ऐसा था कि 5-6 हजार में से भी मतलब 2-3 हजार आ रहे थे। तो आज की डेट में सिचुएशन काफी कंट्रोल में है। दूसरा, लोगों का कॉन्फिडेंस बन गया है। आज किसी को भी ऐसा नहीं लग रहा है कि मैं अगर बीमार होता हूँ, सीरियस होता हूँ, तो मुझे अस्पताल में बेड नहीं मिलेगा या कोई मुझे केयर करने वाला नहीं है। तो दिल्ली के अंदर जो हमने होम आइसोलेशन का एक नया कॉन्सेप्ट लेके आए, उसके ऊपर बहुत लोगों को कॉन्फिडेंस बन गया है। जब घर पे रहते हैं, उनके घर पे हमारे लोग विजिट करते हैं, पल्स ऑक्सीमीटर दे के आते हैं, बाकी सामान दे के आते हैं, दिन में 2-2 बारी डॉक्टर्स बात करते हैं उनसे। तो दे आर क्वाइट कंफर्टेबल और उनको कॉन्फिडेंस बन गया है। और जैसा कि आज मुख्यमंत्री जी ने भी कहा कि हम पता लगा कि लोग जो आईसीयू में थे और ठीक होने के बाद घर जा रहे हैं, तो उनको कई बार ऑक्सीजन की दिक्कत आ रही है। तो नाउ वी विल प्रोवाइड देम ऑक्सीजन कंसंट्रेटर। जी,
I really must congratulate you on what you've done in Delhi. First of all, you've been through such a difficult time. You had to have plasma therapy. You went on to oxygen, and you're looking very well now, touch wood. And hopefully you're full of antibodies and can fight anything. But I want to show you how much we want to congratulate you. If you look at, has Delhi flattened the curve? Just have a look at the data. I think you were just referring to it. So we've been looking at it, and just look at that. It's the only state where the curve has been flattened. That is a remarkable achievement. And now we're just talking about last 6 weeks or so. No other state has done this. Many congratulations, but you still have to be careful, right? The second spikes happen all over the world.
नहीं प्रणय जी, मैं ये कहना चाहूंगा, देखिएगा इटली में देखिएगा, यूरोप में देखिएगा, अमेरिका में देखिएगा। यूरोप में तो खैर सेकंड स्पाइक मैं नहीं कह सकता, पर यूरोप अमेरिका के अंदर अब न्यूयॉर्क, न्यू जर्सी, वहां पर केसेस कम है, बट पूरे अमेरिका में बहुत तेजी से केस बढ़ रहे हैं। तो हमारे को वी हैव टू कीप अवर फिंगर्स क्रॉस्ड, और हमारे को अपने एफर्ट्स को कम नहीं करना है। आज दिल्ली के अंदर लगभग 14,000 हॉस्पिटल बेड्स हैं हमारे पास, पेशेंट्स सिर्फ 3,000 समथिंग है, तब भी हमने उसको कम नहीं किया, स्केल डाउन नहीं किया, क्योंकि हमें लग रहा है कि जब तक ये हमारे को कंफर्म नहीं हो जाता है कि हाँ वाकई में कम हो गया, तो हम अपनी तैयारियों को कम नहीं करेंगे। एक एग्जांपल छोटा सा दूंगा मैं आपको। जितनी भी एम्बुलेंस हैं, सभी एम्बुलेंस में हमने ऑक्सीजन सिलेंडर्स रखे हैं, साथ में पल्स ऑक्सीमीटर रखे हैं, ताकि कई बार ऐसा हो रहा था कि जैसे हमें पहले पता लगा डेथ हुआ, कि भाई डेथ का एक रीजन ये भी लगा, आप पेशेंट को लेके आ रहे हैं और उसमें शायद सिलेंडर नहीं था, तो पता भी नहीं था, ऑक्सीमीटर भी नहीं था कि उसकी ऑक्सीजन कम है या नहीं है, पेशेंट को भी नहीं पता कि मेरी ऑक्सीजन डाउन है। तो एक बहुत छोटी सी इंटरवेंशन जो कि पल्स ऑक्सीमीटर है, उसकी वजह से मुझे लगता है काफी सारे अवेयरनेस फैली और लोगों की जान बचाने में हम कामयाब रहे। तो उसके लिए मतलब, और दिल्ली के लोगों ने काफी हद तक मुझे मानना पड़ेगा कि बहुत सहयोग किया। काफी एनजीओज ने भी, बहुत सारे लोगों ने हमारे साथ डोनेशंस भी दिए, अपना टाइम भी दिया, और मतलब ये काफी एक तरह से मैं कहूँगा जज्बा है कि जिसके लिए मुझे लगता है कि हमें सबको सलाम करने की जरूरत है। डॉक्टर्स ने
I have one worry, two worries. One worry is that Delhiites are now going a bit wild, you know, lockdown fatigue, the crowds in restaurants, etc. But so we need to send out the message that be careful still, as you just mentioned. The other worry I have, and I'd like to hear from you, is this antigen test. You know, if you look at the data, we just had a quick look, that the number of PCR tests is going down. Number of PCR tests are going down, which is the more reliable. The number of antigen tests are going up. So what I really feel is antigen tests are very good for one thing, testing positive cases. But they're negative. When an antigen says negative, it's meaningless because the false negatives are very high. So my request is, don't mix these two data. Carry on with antigen test to identify positives. But the negatives are meaningless. So positivity rate of antigen tests are not good. What do you say about that? Is that don't mix the two, always look at it separately.
थोड़ा सा क्लैरिफाई कर देता हूँ। नहीं पन्ना जी, मैं बता देता हूँ। RT-PCR जो टेस्ट है, उसके अंदर भी जो पॉजिटिव होता है, दैट इज कंफर्म्ड। अगर नेगेटिव है, दैट इज नॉट कंफर्म्ड। RT-PCR में भी ऐसा ही होता है। RT-PCR का जो डॉक्टर से आप बात करेंगे, साइंटिस्ट से बात करेंगे, रिलायबिलिटी 70% ठीक है, 30% तक कहते हैं उसका भी फॉल्स नेगेटिव आने के चांस रहते हैं। आई वॉज वेरी सीरियस, आई वॉज एडमिटेड टू द हॉस्पिटल, और मेरा पॉजिटिव टेस्ट नहीं आया था, नेगेटिव आया था, और डॉक्टर मानने को तैयार नहीं हुए कि नेगेटिव हो सकता हूं मैं किसी हालत में। दोनों दोबारा टेस्ट किया तो पॉजिटिव आया था। दोनों बार RT-PCR टेस्ट हुआ था। जो रैपिड एंटीजन टेस्ट है, मुझे लगता है कुछ पता नहीं किस वजह से इसको थोड़ा सा लोगों ने क्वेश्चन मार्क लगाना स्टार्ट किया है। ये बहुत अच्छा एक इनिशिएटिव स्टार्ट किया गया है। RT-PCR के लिए जब तक आप सिम्टम्स ना हो या आप किसी के कांटेक्ट में ना आए हो, आपका RT-PCR टेस्ट प्रोटोकॉल नहीं है। ICMR के जो प्रोटोकॉल है उसके हिसाब से हो सकता है। बट अगर आप कभी भी हॉस्पिटल में आए, अगर 50 लोग हैं, उनका फटाफट टेस्ट कर लीजिए, उसमें से 5 लोग पॉजिटिव है तो पॉजिटिव हो गए वो। अगर किसी को सिम्टम है, उसका हम RT-PCR अलग से दोबारा से करते हैं। तो मुझे लगता है दिस इज ए वेरी गुड थिंग। आप देखिए, कोई लोग सांस की दिक्कत से अस्पताल में पहुंचे, अब हम उसको 1 दिन या 2 दिन वेट करेंगे, RT-PCR का रिजल्ट आएगा तब हम इलाज करेंगे। उसे रैपिड एंटीजन में तुरंत हो जाता है। इसके अलावा कंटेनमेंट जोन्स हैं, आप वहां पे 100 लोगों का टेस्ट करना चाहते कर लीजिएगा, पर रैपिड टेस्ट ही कर पाएंगे। आप RT-PCR करने के लिए प्रोटोकॉल अभी तक ICMR ने अलाउ नहीं किया है। कई लोग कह रहे हैं कि आपकी कैपेसिटी थोड़ी ज्यादा है, आपने टेस्ट पूरे नहीं किए। दिल्ली के अंदर आप ढूंढ के बताइएगा एक आदमी अगर उसका टेस्ट ना हो पा रहा हो। हमने इंश्योर किया है कि किसी भी आदमी को टेस्ट कराने की आवश्यकता है, उसका टेस्ट हम कराने के लिए बिल्कुल तत्पर हैं, हमेशा कराते हैं। और इसी वजह से दिल्ली अकेला स्टेट है जिसके टेस्ट सबसे ज्यादा हो रहे हैं पर मिलियन के हिसाब से।
Congratulations on the flattening of the curve, the best of any state. We have looked at every single state and Delhi is the best. But I still feel show antigen test results separately and PCR test separately. But that's your call. Thank you very much and congratulations.
And it's great that you've gotten better, and it's wonderful to actually see you in this condition after having recovered as well. Thank you so much for being with us. Well,
thank you.
At this point, we'd like to announce another donation. Let's first hear from Maya Zisweiler, Head of Programs of Social Finance at UBS Optimus Foundation, who sent us this message regarding the UPS Optimus Foundation's association with GiveIndia.
We chose to work with GiveIndia in line with our 3 core principles. One is really scale, because we believe that only with scale can we really achieve true impact. Evidence, really understanding on focusing on what really works, and collaboration, because in collaboration with other experts, partners, funders, that is really where we can have a true impact at scale. And GiveIndia really ticks all those 3 boxes and fits in those 3 pillars. They have a vast network of carefully selected partners that provide a timely response. They were really very fast, but also really respond to the most immediate needs. And to date, our funds have really focused on immediate food relief, as well as providing protective equipment for frontline health workers. So while distribution is still ongoing, the work is still ongoing, what the initial reports show is that 42,000 PPE kits have been distributed, as well as 26,000 N95 masks that have been distributed in the cities of Mumbai, Delhi, Ahmedabad, and Pune. Those cities were obviously carefully selected because of the extent of the pandemic in those areas and the need across those locations. The other thing that we're looking at this point as the pandemic continues is following up with an additional grant that will be funded through employee donations, and we'll continue to try to raise additional funds from our clients globally.
Right. Well, the UBS Optimus Foundation have announced a contribution of 88 lakh rupees to the cause tonight. Thank you so much for your generosity towards the Caring for India Fund. Thank you.
Fantastic.
Thank you so much indeed.
88 lakhs. Fantastic.
Yeah. Well, joining us now, Priyanka Prakash, the head of online giving, marketing and partnerships at GiveIndia. How can you start a healthcare fundraiser on GiveIndia? A lot of people would be wanting to know this. Can you talk us through the basic steps?
Starting a fundraiser is easy to do. So it's really about 3 to 4 steps. One is you go to giveindia.org, fundraisers.giveindia.org/medical. And once you start a fundraiser, we have some basic requirements. You have to upload your documents which are related to diagnosis, treatment, and your medical bills. And also write a story about what you're going through. Once you do that, it's almost like it takes about 5 to 10 minutes for your fundraiser to get created. Once that is done, the second step is for you to share it with your family, with your network, with your friends. GiveIndia also provides a lot of promotional and public outreach support. We have a campaign team, we have a content team that helps you craft your story really well. And after that, once we start raising funds, it's about reaching back to your donors and asking them to, get you more support on their own and engage them and also manage your funds. So it's really a very simple setup and we have a team that helps you do that as well.
प्रियंका, बहुत बहुत धन्यवाद ये समझाने के लिए। दर्शकों को बहुत बहुत शुक्रिया। और हमारे साथ खास पैमाने डॉक्टर अब्दुल समद अंसारी, डायरेक्टर क्रिटिकल केयर सर्विसेज नानावती सुपर स्पेशलिटी हॉस्पिटल इन मुंबई। डॉक्टर साहब, इस पैंडेमिक में जो ये पूरा कोरोना वायरस है, बहुत बहुत धन्यवाद एक तो समय देने के लिए। आप लोग इतने व्यस्त होंगे। जो ये ट्रीटमेंट को लेकर लोगों के जहन में बहुत भय है, आप हमारे दर्शकों को बताइए कि अगर कोई एडमिट होता है तो होता क्या है? जी।
So, thank you very much. First of all, this is a wonderful initiative, and this was long needed. And coming back, I think it is more of the fear which is gripping the society. सबसे ज़्यादा ये जो भय का माहौल है, इसकी वजह से हर इंसान इस बात से चिंतित है कि अगर मुझे कोविड हो जाए या अगर मुझे कोविड हो चुका है, तो उसकी वजह से मेरे फैमिली मेंबर्स में what happens to my surroundings. And when I go to the hospital, whether I will come alive. This is for the first time, even young and fit people are really concerned about the case fatality. And I think this is some form of mass, hysteria as well as paranoia, I would say, because the case fatality ratio in our country has been actually very less. 2.7% is the total figure that comes from India. I am sure that this data may not be completely accurate, but in our hospital, when we look back, out of 1,500 patients that we have treated over the past 5 months, we had not even 100 mortalities. And we are talking about hospitalized patients who are sick, moderate to severe, not even mild, and which is probably, looking at that, less than 15% of any sample size. So 85% of the patients who are in the community, in COVID care centers or at home quarantine, they are doing well, except for a lot of prolonged health issue, which we are noticing. Majority of them have recovered very well. And I think that needs to be emphasized, underlined at every forum.
All right. We're going to carry on with this. Dr. Swapnil Parekh, co-author of the coronavirus book and the co-founder of Plasma Yodha, also with us. Thanks very much for being with us. Can you tell us in simple terms, What exactly is plasma therapy for COVID? How is it essentially a painless process? And how is it something that has so much hope?
Dear Nidhi, Vishnu and Dr. Roy, thank you so much for having me on NDTV. It's such a pleasure to be with you today. Happy Independence Day to everyone watching. Plasma therapy is a therapy that's over 100 years old. It's been tried for a variety of illnesses, infections, successfully in some cases, unsuccessfully in others. Plasma is a component of blood that contains proteins known as antibodies. These antibodies can target specific viruses and neutralize them, provided that the right kind of antibodies. So plasma therapy for COVID-19 is premised on convalescent individuals, that's people who recovered from COVID-19, donating their plasma in a very painless way. It's as simple as a blood donation, even safer than a blood donation. And if this plasma has certain kind of antibodies, what we call anti-S protein antibodies, and if they are present in a sufficient number, so you'll see the S protein are these little spikes here. So if there is an antibody against that spike, then if we transfuse this plasma into a patient early in the infection with COVID-19, it could help neutralize the virus. So that's the basic premise of plasma therapy. The promise of it is not just for individuals who have been infected and have COVID-19, but it could also help prophylactically. So people who've been exposed, it could protect them for around 20 days. It's a passive form of immunity that can be transferred from one person to the other. And from plasma therapy, research on plasma, on convalescent plasma, we can develop monoclonal antibodies. We can understand the various immune markers that are there. So there's a huge potential of studying convalescent plasma.
डॉक्टर पारेख, बहुत बहुत धन्यवाद जुड़ने के लिए। वाकई प्लाज्मा थेरेपी के बारे में लोग बहुत जानना चाहते हैं, समझना चाहते हैं, क्योंकि ये बहुत साइंस सिद्ध हुआ है। बहरहाल आइए आगे बढ़ते हैं और हमारे साथ संदीप एक बार फिर जुड़ गए। संदीप, गिव अस अ वेरी ब्रीफ ओवरव्यू ऑफ व्हाट द इंटरवेंशंस विद रिगार्ड टू ट्रीटमेंट इन्वॉल्व्ड एंड व्हाट गिव इंडिया इज डूइंग इन दिस स्पेस।
COVID treatment has been a challenge, not least because there is no silver bullet, as Dr. Swapnil Parekh mentioned. And while we looked at all of the classical therapies, we noticed that plasma therapy was an area that was not getting sufficient attention, partly because there were not enough convalescent donors. And this has to do with stigma, it has to do with, in many cases, myths surrounding, contributing plasma, and in some cases, there were just not enough incentives. So we decided to actually support Plasma, the platform that Dr. Swapnil Parekh just talked about, and try and actually build a pilot in Mumbai to see if we could accelerate the contribution of plasma and thereby treatment. That was one. The second area that we looked at in terms of treatment was actually a consequence of the fact that there were insufficient number of beds in many cities, including Mumbai. And the question arose that can you release the pressure on the healthcare infrastructure by seeing if we could treat non-critical patients in their homes. So we partnered with Portia in that case to actually look and explore options for treatment away from these high-pressure areas of hospitals because there were not enough beds. So these are two areas that we looked at in terms of treatment, and they've both borne fruit. They're one of our more recent initiatives, but they've been very successful.
जी, बहुत बहुत शुक्रिया संदीप इस जानकारी के लिए एक बार फिर से। और एक अच्छी जानकारी दे दे, anonymous corporate donor has come forward to make a contribution, Vishnu, of ₹50 lakh towards the Caring for India funds, and specifically for providing PPE kits for frontline medical workers.
Thank you so much. Indeed, that contribution absolutely superb. Well, we've got two fantastic guests, and I confess to knowing both of them, Nidhi, quite well. Raghavendra Prasad, founder of Step One, and Dr. Shuchin Bajaj, the founder-director of the Ujjwala Cygnus Hospitals. Thank you both very much for being with us. Raghavendra, what is Step One's involvement with plasma donation in Delhi?
In Delhi, Project Step One is helping the Delhi government in the fight against COVID in terms of mobilizing donors for plasma as well as helping the donors to be matched with the right recipients. The intervention in Delhi was enabled by the government when it set up the plasma bank in ILBS, which is a Delhi government-owned hospital, and they were not able to get enough donors to come forward and donate, and in spite of a lot of campaigns, and that's when they requested if Step One can help. And what we started doing was we started having the volunteer doctors on Step One talk to each of these donors personally and get them to come down and donate. Whenever somebody turns COVID positive, there are two reactions. One of the two reactions. One is, they continue their life, as if nothing happened, and the other extreme is they completely, utterly panic and do things which they shouldn't be doing, like for example rushing to a hospital and demanding a bed and things like that. So a call from a doctor basically helped make the reaction a little subdued on both counts. People who completely didn't care that they had COVID and were going about their life as their normal, the doctors would counsel them that that is not the right thing to do, and they should be isolated in their house. And also on for people who are extremely panicky, they would calm their nerves and help them to think a little bit more rationally. This relationship actually went on for until the time these people recovered. The citizens who were COVID positive actually recovered. So there were deep bonds between doctors and volunteer doctors and citizens, and the impact of that is actually immeasurable.
Ji, we have with us Dr. Sachin Bajaj. Dr. Saab, what has been the impact in Delhi so far?
The impact, I think, has been massive. Everybody is speaking about the Delhi model, and we are just lucky and very proud and privileged to have been a small part of it. I think we connected to hundreds of thousands of patients. If you think that R0 is about 2 to 3, anywhere between 2 to 3, connecting to about 90,000 patients in Delhi. The last time we had the data, I think it's more than 100,000 now. If you see that, the R0 is, let's say 2.5, you prevented almost 2.5 lakh new infections because we made sure that these people either stayed at home or went to hospital and did not keep roaming around, did not go out, did not become super spreaders. So I think that made a big difference between what the assessment of everybody was initially when the pandemic came in. Initially, the investment was, the expectation was that Delhi would have lakhs of cases by the end of July. I think that really helped in keeping the cases down to manageable and keeping the hospital beds free, and most importantly, preventing panic. And I think the plasma bank itself had amazing impact. We could save hundreds of lives because we managed to collect the plasma at one place and gave it out completely free of cost.
जी, डॉक्टर बजाज, मैं आपसे पूछना चाहूंगी कि दिल्ली का मॉडल अगर हमें रेप्लिकेट करना है अन्य राज्यों में, तो किस तरह का सपोर्ट चाहिए होगा आगे बढ़ने के लिए?
I think the fact that replication of the Delhi model, as we say, I think the most important part is getting in more volunteers. So I would urge all doctors and other volunteers, techies, whoever wants to play a small part in it, I would urge all of you to come and volunteer with us and try and help patients in the short term, COVID patients. And in the long term, we can help thousands and millions of other patients as well. The second important factor would be, of course, the government support from the territories that we work in. Delhi has been an amazing example. The government has really gone out of the way to help us in any way we wanted. I mean, there were so many helps from the Delhi government, I can't really enumerate. But that will be the second most important factor to replicate that model.
Sachin, thank you very much for being with us. Raghavendra, thank you very much as well. Well, joining us, Priyanka Prakash, the head of online giving, marketing and partnerships at GiveIndia, back with us once again. Now, you've shown us how to start a healthcare fundraiser. Tell us how people have benefited.
So we've had people come from varied backgrounds, especially over the past 3 to 4 months. And, they face different kind of financial distress or situations. For example, there is this old lady who came into us who did not have any funds whatsoever to, take care of her treatment. What we do is we set up fundraisers. We have a campaign, content and marketing team so that you can set up the fundraisers very seamlessly. We help you tell the story really well. And also we help you fundraise through marketing and promotions. We've had also cases where, for example, during COVID, we had one wage worker who lost his job, but he also found out that he had cancer at the same time, and there was absolutely no way he could support himself. So we took it on ourselves to set up the campaign and raise funds for him, and now he's able to, take treatment for himself. We've had several wage worker stories like this. Another story where a family which has an income of about 20,000 rupees came to us asking to raise funds for their daughter who has leukemia. She couldn't even take her monthly chemo treatments, but we set up the campaign. We did a really good job with the storytelling, and we were able to raise enough funds, and now she's able to take treatment every month. So the focus for us internally is, as a team, we're very passionate about, changing lives. People take a lot of pride and enjoy that work. So we have a relationship manager, we have campaign teams and marketing teams who support people so that, they can focus on their providing support to their families, where we can support them with raising more funds. So that's how we support these fundraisers.
जी प्रियंका, बहुत बहुत शुक्रिया जुड़ने के लिए और वाकई समझाने के लिए कैसे आप लोग मदद पहुंचा रहे हैं. धन्यवाद. और अब हमारे साथ we have Meena Ganesh, CEO and Managing Director, Portia Medical. I'd like to ask you, how does the home quarantine process work?
About 85 to 90% of patients who are COVID positive actually are either asymptomatic or mildly symptomatic. So the requirement is really that they need to be trained and educated on how they should manage their health, their hygiene, their food, their surroundings, and how they should be isolated from the rest of the family. That's a very, very important aspect. Thereafter, it's important to monitor them on a daily basis to see how their vitals are doing. And if there is any change at all, we need to find a way to help them. Now, so on the first day when a patient is identified for home isolation, we do a very detailed onboarding call. So we understand them, they understand, they get educated, their family members get educated on what are the do's and don'ts. Thereafter, every day we call with the help of a healthcare worker to check on their key vitals, their temperature, their breathing, any change in symptoms from the previous day, throat pain, change in its ability to smell or taste, because any of those are indicators, I think, that things are getting worse. If any of them feel that there is any worsening of the symptoms, or if we feel that any of the vitals are looking bad, we immediately get a doctor consultation for them. The doctor talks to them, understands better what's going on, understands also any comorbidities or any other conditions that might be there, and basis that may prescribe a medicine or prescribe a course of action. We also keep track of how the patient's family members are doing. If any of the family members are developing symptoms, then we determine what needs to be done, whether they need to be tested or any action needs to be taken for them.
Ma'am, what kind of impact has Portia had with regard to home quarantine? Have you had a lot of takers on this?
So we started working in the first week of May with one of the governments, and thereafter we worked with multiple governments. A total of about 50,000 plus COVID positive patients have been monitored by us, of which 45,000 have already been discharged, which means that they are fine and back to normal life. The balance 5,000 are still being monitored. A total of 3%, in fact less than that, about 2.5% of patients had to be hospitalized. All the others, that is 97.5% of the patients, have recovered from home or are continued to be monitored at home. Now, this is a huge benefit for the healthcare ecosystem. The burden of moving people, more and more people into COVID care centers or into hospitals is minimized. And those that need real attention are the ones that are getting attention. So the healthy people are not sitting in COVID care centers and hospitals. The people who are falling sick are able to get access to hospitals and beds.
Thank you, Meena ji. Thank you so much for giving us this information. Now we have Nachiket Moore, a visiting scientist, the Banyan Academy of Leadership in Mental Health. He has in the past been an RBI board member and also the India country director at the Bill and Melinda Gates Foundation. I'd like to ask you, Mr. Moore, what is oxygen therapy and how is it useful in the treatment of COVID-19 patients?
We know that the manner in which the disease progresses, almost 80% of the people who are infected recover without any treatment necessary at all. The 20% that do need treatment, we also know that somewhere near 80% of those actually recover with basic oxygen therapy, which comprises low flow oxygen and high flow oxygen, well before they need ventilation.
And Mr. Moore, how has ACT been involved in this, and what sort of difference are you seeing it make?
So ACT realized fairly quickly that there were two challenges that the country was facing. One, there wasn't an adequate supply of devices that were needed. Those that were available were largely imported and fairly high cost. And the second issue was there wasn't an adequate supply of oxygen that needed to be addressed. So in both of these areas, ACT decided to intervene. On the oxygen side, it was relatively simple to make available wherever there was demand, particularly in remote areas, in high impact states, oxygen cylinders that were required. But for the HFNC, the high flow nasal cannula, the high flow oxygen devices, more work needed to be done because we needed to find a local entrepreneur that had the capability to develop a device that was at a low cost, to get it tested with variety of hospitals and to get it approved and authorized. So we played a partnership role to try and make this happen and to actually successfully get out a far lower cost domestically manufactured HFNC device in the system. Thus far, we have supplied over 1,000 oxygen cylinders,
right,
and over 100 HFNC devices.
Right. Thank you so much for being with us this evening. Siraj Dhanani, founder, CEO of Inexcel Technologies Private Limited, joins us. He explains to us Inexcel's role in providing assistance to the healthcare system in India.
So back in March this year, we at Inexcel realized that non-invasive ventilation would be a critical and life-saving technology for respiratory support for COVID patients in hospitals. Given that there were no indigenous solutions available, we moved rapidly to develop SARS Pro, a system which provides both HFNC and CPAP modes of non-invasive ventilation for COVID patients. In parallel, we also developed India's first CPAP helmet interface for safe ventilation of COVID patients in collaboration with Thermax Global and doctors at Narayana Health, Bangalore. Both these products were developed in a record time of 4 months and are now commercially available. And in fact, over 100 SARS Pro systems and about 600 helmet systems are being deployed in hospitals across India in August alone. I'd like to mention ACT's generous and timely support, which has been crucial to the development, launch, and scale up of this critical technology and has given us this opportunity to serve our nation in this time of need.
All right. Well, joining us, Dr. Dilip, thanks very much, sir, for being with us. I just want to introduce him first. It's Dr. Dilip Brahman, I believe, who we have with us. He's the director of Cloud Physician Healthcare Private Limited. My first question to you is this: what is the remote ICU, and what is the need on the ground for this solution?
India has a massive shortage of trained ICU doctors. These ICU doctors are also called intensivists. Only 1 in 10 ICUs in India have a fully trained ICU doctor at bedside, and there are only about 5,000 or so qualified intensivists in India today. A remote ICU solution mitigates this problem by connecting a spoke ICU to ICU doctors or intensivists located at a command center. or a hub center. The hub has experienced doctors and nurses that assist these remote spoke locations by filling this skill arbitrage. They provide evidence-based ICU care and care to the critically ill patients and provide them support 24/7 using real-time audio, video, and teleconferencing solutions.
Dr. Raman, what kind of impact have you seen on the ground?
Yeah, the impact of tele-ICU services in India has been multifaceted. Care management and remote monitoring and protocol-based care has improved significantly in our spoke sites. This has resulted in a more streamlined care for our patients, and the care plan has been more direct and action-based. All the information that we have is digitized and is available to the on-site and remote team for enhanced care, decision-making, and reducing errors. And overall, this improves efficiency. The healthcare providers can also use this technology to keep themselves safe by avoiding unnecessary exposure, as most of the data can be gathered remotely using the platform. We've been able to engage with patients and their family members a lot better, and the technology allows them to see their loved ones and interact with them despite the barriers that COVID has mandated these days. The government doctors and nurses who are working extremely hard and are doing their best use the tele-ICU services from us, and we're able to support them take care of their patients and provide state-of-the-art critical care expertise in addition to the work they're already doing at the bedside.
Right. Vishnu Nidhi, I have a question for Dhruv Joshi. I was very impressed. Do you plan to scale this up and take it to other parts of India as well?
Yes, today we are working very closely with hospitals in districts in Karnataka and Maharashtra, and we are actively engaging with other state governments and other hospitals in other states as well, including Orissa, Bihar, Andaman and Nicobar Islands. These are all states that have similar problems in the healthcare delivery system for ICU patients, and our solution can be used in all of these states and many more going forward to help improve the outcomes of patients.
Thank you so much, doctors, for the cloud physicians, as they say they are called. Let's move ahead. One of the states that the remote ICUs have been implemented is in Karnataka. Dr. K.V. Trilok Chandra, Special Officer, Critical Care Support Unit with Government of Karnataka, tells us how it has worked in that state.
Cloud Physician has partnered with us to take care of certain parts of the state with the real-time monitoring of all these high-risk cases which are in the ICU, and with their intensivists in the back end has really helped in augmenting the local resources also which is available, and also it acts like a force multiplier so that high quality care is available, and also to guide the local manpower, both the doctors there as well as the nurses who are there monitoring the patients. So this has really helped in the micromanaging the patients, but with a remote approach, and also the same intensivist can handle more patients at the same time. So this tele-ICU model which is there is easily scalable, replicable, and it takes care of the shortage of these intensivists.
All right, Dr. Chandra, thank you very much for sharing that experience. Joining us, Atul Satija, founder 2.0 and CEO of GiveIndia. Now, as we wrap this up, we're going to ask you to look ahead and tell us, what do you hope GiveIndia will have achieved 6 months, perhaps a year from now?
Yeah. So over the last 20 years, we have been a part of every disaster India has seen. But this is something else. We have not seen anything even close to this. We know over the next 6 months to 1 year, we have to stay very, very focused on serving the people, all the fellow Indians that are going through a lot of difficult times across the country. There are multiple things. We are seeing numbers, as high as hundreds of millions of people that are pushed deeper into poverty or fallen back into poverty. So we want to make sure that we are able to do the best we can. In the short term, we want to keep our eyes on the COVID-related healthcare work. We want to make sure that we are able to raise the support, all the things we've been discussing over the last couple of hours. How do we make sure that we are able to get this support to wherever it is needed on the ground? I think in parallel, we have to now start working on a midterm recovery as well. A lot of people, the migrants that are coming back into cities as they find their jobs and livelihoods, can they get the benefits that government is announcing? So benefit access work is something that we hope to start soon. And over the long term, there is a lot of livelihood work that we have to do. People have to start making money, have their livelihoods, increase their, get productivity levels back up. So sustainable livelihood work, both in the rural areas where people are, as well as in the urban areas where they are going to come back to work. So
Right,
we think we'll stay focused on COVID for now.
Atul, Satija, it's been great for NDTV to work with GiveIndia. We're just amazed at the work you've been doing, and especially looking after these frontline workers and providing them so much equipment and backup. That's an area which will, people are saying, okay, we have lockdown fatigue, things are going better, but it's going to be a long haul still, right? So you are going to focus on doctors, nurses, and medical staff still ahead, looking ahead the next 6 months, right?
That is correct. So doctors, nurses, paramedics, but also people that are providing essential services, ASHA workers, Anganwadi workers. So we'll obviously expand the work, but stay very focused on making sure that the healthcare services are not disrupted while we need them.
अंत में मैं आपसे ये भी पूछना चाहूँगी कि तमाम मुझे मैसेजेस आ रहे हैं कि जो ड्राइवर्स लगे रहते हैं, जो ट्रांसपोर्ट सर्विसेज और जो सफाई कर्मचारी भी लगे हुए हैं, मैसेजेस आ रहे हैं कि हमारा भी जिक्र कर दीजिए.
Right.
So I think my appeal to everyone is that ऐसा कोई भी हमारे भाइयों बहनों, anybody who's going through difficulty, I encourage all of them to come to a platform, actually raise the need that they have as a fundraiser on the platform. And we will make sure that we are able to work with them to support their financial needs during these difficult times.
All right, Atul, Satija, it's been wonderful, working with you on this program and, and learning about how these contributions are really all about saving lives. But I think the key point that Roy mentioned is it's still a long road ahead, and one can only hope that things get better soon. But in the meanwhile, it's so very important to keep protecting ourselves, wearing a mask, and hoping sooner than later there is that vaccine that comes.
बिल्कुल विष्णु, और हमें अपने लगातार कोरोना योद्धाओं की मदद करनी है.
Right, Nidhi, I think the key point is actually about masks will eventually help our doctors as well. And the beauty about masks is that so many women's groups are making masks. So what ends up having, you provide employment and you provide masks, and if possible we should give it free. Apart from the good news about generally the trend coming down of R and the other good news in India, the real positive other fact that we'd like to bring out is that our tests are now over 8 lakhs a day. When it was 40-50,000, we were quite happy. We say, no, we got to hit 1 lakh, we got to hit 2 lakhs, then we hit 500,000 or 5 lakhs. Yesterday it was over 8 lakhs of tests. Now we got to go over 1 million tests a day, but 8 lakhs is very good. Yeah, so there are a lot of good things happening.
And there's a little bit more good news to share, Dr. Roy. I've been told how much we've been able to raise on this program, how not just us, but all these people all across India and the world have been able to raise 2 crore 6 lakh, and this is a start. People can keep adding. So 2 crores 6 lakh.
That's
so
great,
far.
and it goes on for the next 2 weeks, and we've noticed that online people donate more and more as time goes on. But to start with 2 crores is very good.
Yeah, it is indeed. We'd like to thank all of our viewers very much for being with us. This is a journey that we'll keep following in NDTV. For the moment, from all of us here, goodbye.